Malnutrition in Guatemala has become an epidemic amongst the global humanitarian crises of the world. Nearly 50% of children in Guatemala experience growth and developmental delays due to undernutrition. Undernutrition can be life-threatening, connected to about 45% of all death for children under age 5 in Guatemala. These rates make Guatemala one of the highest risk countries for child stunting and malnutrition in the world. These issues are rooted in social determinants of health that include agriculture instability, water access and poor infrastructure or WASH, and systemic poverty. This team of students has come together to work with the Church of Jesus Christ Office of Humanitarian Services to find ways and study best practices to overcome malnutrition amongst children under age 5. The Church of Jesus Christ of Latter-day Saints has a focus on this as they consider all children to be children of God. Through this project, we are studying these goals so that they can be able to go out to connect with organizations and partners globally so that they can find solutions that will cause systemic change.
In order to successfully complete this project, we set 5 SMART objectives. These objectives were closely linked to our deliverables, which we used as a timeline to refer back to throughout the semester. Our first objective was, by week 6 of the semester, compile and analyze key geospatial data on contributing factors to childhood malnutrition in Guatemala and deliver it to the BYU Geography Department. We felt that this objective lined up well with Area 4 of the National Commission for Health Education Credentialing, or NCHEC, competencies, which is evaluation and research. The second NCHEC area of responsibility that we identified as important to the project was Area 1, Assessment of Needs and Capacity. We had 2 SMART objectives linked to this area. By week 8, organize research into a logic model to create visual representation of malnutrition in Guatemala. By week 10, complete a thorough written community assessment that identifies potential root causes of childhood malnutrition in Guatemala. Our next objective was, by week 12, propose an implementation plan based on the evidence to suggest best practices and possible interventions, including possible organization-based partnerships and social impact projects. This objective lined up with Area 3 of the NCHEC competencies, implementation. Our final objective relates to Area 7 of the NCHEC competencies, leadership and management. By week 14, create a professional informative presentation summarizing key project findings for the area professionals of the Church of Jesus Christ of Latter-day Saints' Humanitarian Services.
We created 6 deliverables for the project that we believe will help you to be more informed when you're trying to address undernutrition in Guatemala. The first was a data set where we compiled 45 different types of data from different databases in Guatemala, and they all had to do with different social determinants of health that relate to child nutrition. This we passed off to the BYU Geography Department, which they will use to make into a map that you can use to see which regions in Guatemala are in highest need of extra nutrition support. The second deliverable was a community assessment. We spoke with one of the church's partners. His name is Luis. He's from Guatemala, and he told us more about the boots on the ground perspective of what it's like to be malnourished in Guatemala. We used the information that he shared with us to prioritize which of the variables we found in our research would be most important to address through interventions. And this community assessment we wrote up, and we based it off of Luis's information as well as other research that we had done. Our third deliverable was a logic model, which is where we mapped out which of the variables are most important and how they connect all the way from a structural level down to a home and then to health outcomes for individual children in Guatemala. This logic model creates a process by which we can create interventions because we understand how these problems are connected to each other. Our next deliverable was a list of interventions that we came up with that are well-researched best practices for addressing undernutrition in children in Guatemala. We chose a few of these interventions to write more about and research more about, and created a plan for how the church could implement these in Guatemala. We also created slides that can be used and shared with other partners and stakeholders to explain in summary what we did in our project. And finally, we drafted up a final report that includes all of these deliverables that we talked to you about compiled in one place, as well as our additional conclusions.
Within Guatemala, we determined that there were numerous root causes, a few that we wanted to focus on were systemic poverty, rural and indigenous areas, lack of resources, lack of transportation, and climate change. Throughout the last 4 months, our group has determined a few interventions that we believe that would help malnutrition within Guatemala among younger children. Our research identified these interventions that would be best: micronutrition deficiencies, health education program, and agricultural diversification. With the interventions previously mentioned, we believe that those would not only make a difference immediately, but also make a long effect through future generations, helping them be well educated about nutritious foods that can be provided, in addition prevent and reduce the amount of malnutrition children within Guatemala.